Thank you so much for joining today's workshop. We're going to dive into the different types of Medicaid. Today, we'll specifically be discussing Medicaid in New York, but these principles apply throughout the state. It depends on whether or not the state is an expansion state or they participate with Medicaid. But I would say about 80% of the rules that we'll discuss today will apply to each state. So first, what we're going to do is overview the different Medicaid programs. So many of us are in the industry. We run into clients, or our clients have needs where they need Medicaid, whether it's a medical need or it's a financial need. And so today we're going to talk about two different categories that are specific to Medicaid. It's MAGI and non-MAGI category. And some people may say MAGI. It depends on where you're from, but I'll say MAGI for this demonstration. So basically, the first category is MAGI. It's modified adjusted gross income. And basically, this serves the low income adults, children, pregnant women, those without asset limits, and they have simplified income rules. And typically, these are under 64. They're not on Medicare, they're not senior citizens or disabled. They are able bodied. And I do want to say this is the group that primarily Medicare, the new administration is focusing on. They're focusing on the able-bodied ones, those that they deem able to work and don't really have a medical need. These are the ones the current administration is trying to strike down and trying to remove access to this program. So the next group is non-MAGI, Medicaid. So basically the overview for this group are the senior citizens. These are disabled ones. These are ones on Medicare. They're typically over 65 or disabled. Sometimes included is the disabled age blind Medicaid. We have QMB, which is a qualified Medicaid beneficiary program. We have SLMB and QNI. Typically, the people in this non-MAGI group are requesting more Medicaid services. So it could be home care services or other services like that. Now, for MAGI, the applicants that want to apply for this particular service need to apply through the state healthcare marketplace. For us in New York, it's the New York State of Health Marketplace. Now, for non-MAGI, this particular category, they would have to apply through their local Medicaid office. And basically, they would send them their applications, and then they would be able to apply with whatever required documentation. So in summary, so far we've talked about MAGI. That's those that are under 64, they're not on Medicare, and they're able-bodied, they're not disabled. And they have to meet the low income and asset limits. Now, non-MAGI, as we talked about, they're typically over 65. They're on Medicare, and they're requesting additional services like home care services. So they have a specific income and asset limit, and that will depend state by state. Now, let's move to community-based Medicaid. That's primarily what I deal with here. What we deal with we work with HV Medicaid are those that are non-MAGI. They are disabled. They're requesting additional services from Medicaid. Basically, community-based Medicaid is designed to keep applicants safe, living safe in the community, although they need skilled nursing care assistance. And this could be assistance with their daily activities of living. Again, those activities of daily living can be toileting, bathing, grooming, transferring from one seat to another. That could be from the toilet to the couch, from the wheelchair to the bed. And I will be honest, New York has, as of September 1st, they've become extra strict with this rule. And for community-based Medicaid, they're requiring at least 3 out of the 5 ADLs in order to qualify. So if you have a client that you're meeting with during open enrollment and they ask you or tell you that they're in need of home care services, we want to think about the activities of daily living. Ask them, what do you need help with? Why are you wanting to apply for home care services? And what we try to do is we either look for major diagnoses like diabetes or dementia, Alzheimer's, congestive heart failure. Those are major diagnoses which make it easier for a person to qualify. But at times we have to combine illnesses. Maybe they have congestive heart failure along with diabetes, or maybe they're fatigued. And so because of that, we can put that together. But that's our job. That's what we do here at HV Medicaid. We help you with your clientele. We help you with your book of business to put the pieces together so that they can qualify for Medicaid. Now, another qualification for eligibility is the income limit. We know that for individual applying in the state of New York, if they're disabled, they can qualify for long-term care services for the community-based services. Most people, let's be honest, they earn over $1,800, but New York State allows us to put in place a pooled trust, as we spoke about in other workshops, and we put that spend down into that pooled trust, hence they're able to qualify for Medicaid for these long-term care services. Now, if their assets exceed the $32,000 limit, then as we mentioned before in other workshops, we can set up an irrevocable trust and transfer those assets to that trust, and then they can qualify. Now, one interesting thing, if they're married, the state considers a married couple one unit. So if there is a non-applying spouse, we can easily transfer assets to the non-applying spouse, and hence that's not considered a transfer per Medicaid, and they're able to qualify for Medicaid. Now, when for home care, community-based Medicaid, as we mentioned before, there's no look-back period. Now, the state of New York is threatening to change this to a 2.5-year look-back period. Basically, they want the look-back period is they're trying to determine if someone's transferred assets out of their name or divest themselves illegally by giving away assets below fair market value. And I always want to remind brokers when you're meeting with your clients, remind them that the Medicaid gifting rules are not the same as the IRS gifting rules. So it's very important that they realize that, because basically after the age of 65, I really encourage my clients not to gift anything. They can set up a irrevocable trust if they like to do that, or transfer perhaps their assets to their spouse. But other than that, unfortunately, the government makes it very difficult. Every program has its own rules. And regarding the Medicaid gifting rules, basically you cannot gift. So it's important, if a person is maybe in their late 50s, early 60s, if they want to go ahead and make gifts to their loved ones, I suggest them to do it at that time, because they have no look back period for that. But once they apply for Medicaid or they apply for Medicare, unfortunately, that's when the look back period is floating over their head. And so we always suggest that they set up irrevocable trust with the elder law attorney, or do those transfers before they'll need Medicaid services. And because of the time is of the essence, because of the New York State laws moving and changing very quickly, it's important when you're doing your reviews with your book of business for open enrollment that you address these needs for community-based Medicaid now, because in November, they're going to implement new changes, even in the state of New York, that is making it very difficult to qualify for these services. So it's important that when you are with your clients during open enrollment, ask them about their long-term care needs now. Ask them about their activities of daily living. If they need assistance, if they need help with toileting, with bathing, with grooming, with getting moving from one seat to another, or let's say they're fall risk, they're non-ambulatory, they're very weak or fatigued. If you hear illnesses like dementia, Alzheimer's, or diabetes makes it where they have neuropathy. If you hear these small little illnesses or these major diagnoses, they're a candidate for long-term care or community-based Medicaid, and use these tools when you're meeting with them during open enrollment to help them to see that they can qualify for additional services. And that will protect your retention, because when you as a broker provide extra services that they don't realize they qualify for, they'll never leave you. So in review, the community-based Medicaid product is designed to keep the applicant safe in the community. They need assisted living or additional services, but they're not yet at that state to go to a nursing home. In New York, because we have no look back period, when you guys are meeting with your clients, definitely bring up home care services, especially if they're ill and they are deteriorating and declining quickly, because this is a product that can really help them, and it helps them age gracefully because they're able to stay at home. Now, let's look at institutional Medicaid. Now, this is also known as nursing home care. And it is, I say, it's like community-based Medicaid on steroids, because basically what it does, it provides 24-hour care for someone that needs help with those ADLs that we were talking about, but on a 24/7 schedule. Now, Medicaid, nursing home Medicaid or institutional Medicaid, as it's known, is difficult to qualify for, because if you compare what we've just talked about, the community-based Medicaid, there's no look back period. But for institutional Medicaid, there's a 5-year look back, and that is state countrywide. There is no variation with that. So that means a person that is planning or depending on having institutional care needs to prepare ahead of time, years ahead of time, to either transfer those assets out of their name to protect it against Medicaid lien, or to prepare their income in the way that they can prepare for this. Because let's say, for instance, they're doing an annuity draw, a required minimum distribution. They're taking a draw from their retirement month by month. If they apply for nursing home care, I like to consider nursing home care, it's a vacuum. It sucks away all of your assets. It sucks away all of your income. Once a person applies for nursing home care, their income is diverted directly to the nursing home, which means, I think in the state of New York, they give them a $50 allowance. But after that, everything goes to the nursing home. Now, I do want to mention there is a provision for there's a provision for spouses that aren't applying. The state cannot punish a spouse that is not applying. They can't punish them because their spouse is applying. So let's say the non-applying spouse depends on the spouse that's applying their income to survive off of. And if this was the case, let's imagine if all the money or their income went to the nursing home, that could deprive their household of food, of necessities that they need. So there are provisions, legal provisions, that the state provides to make sure and protect the non-applying spouse, so that they're not punished. In a sense, they're not pushed into poverty because their loved one is applying for Medicaid and nursing home care in this sense. But again, it's very important to do Medicaid planning, asset protection, because when you start this process of nursing home care, let's say they live at home right now. Let's say that they're fine, but in a few years they need nursing home care. The moment they vacate that home, it's open for Medicaid lien. So hence, it's important to do proper Medicaid planning ahead of time. Set up those irrevocable trusts. Shift those assets to a child or a loved one. That is considered a transfer, but let's say they are at a point where they're still able to move around. They're not at a point where they're totally, where they need 24-hour care. As let's say today's October 3rd, let's say they shift let's say, for instance, a applicant has a child, and an applicant is in need of community-based Medicaid. Now, they can shift. Let's say they're a widow or a widower. They have no one spouse to shift those assets to. They can shift those assets to their children, but that does, or a loved one or a friend, but that does trigger the 5-year look back. But as long as they can stay home within that 5 years, so let's say October 3rd, they make the transfer. 5 years from now, as long as they don't apply to go to a nursing home between those 5 years, they avoid the Medicaid penalty. So again, proper Medicaid planning is very important, because there are many ways or workarounds, especially in the state of New York, to have access to community-based Medicaid, to have access to nursing home care. But again, we have to be careful, especially with the new bill that was placed, a big, beautiful bill. They're making it much more difficult for applicants that have a medical need to access these products. So it's important that we encourage them to start early. I know that I would say about 99% of our clientele, our application process is we're in crisis mode. We're in where they either have had an accident or they've had a stroke and heart attack, and all of a sudden now they're thrust into a crisis. But it would be much easier for the family and for their loved ones if they would prepare early. And we want to encourage our clients, even though none of us want to think about getting older, none of us want to think about declining health, but the thing is it's going to happen whether or not we think about it. So it's important as brokers, it's important as Medicaid planners to encourage our clientele to think about putting into place a plan of action so that when they can age gracefully and with dignity. And by Medicaid planning, they can do that. Because once this process starts, once they need nursing home care, there's nothing you can do to protect their assets at that point. All of their money is going to go to the nursing home unless they have a spouse or a disabled child. Other than that, all the money goes to the nursing home. The assets are opened up for lien unless you have the irrevocable trust. You transfer those assets to a spouse, or if there's a child caregiver in their home that's lived in the home for at least 2 years, or a disabled child. So there's um, four categories or ways to protect that. But other than that, there's no other exemptions. Once this starts, there's nothing we can do. And recently I had a call from a client that um, his brother, he had a traumatic brain injury, he had a bad accident, and they weren't expecting this because he was in his mid 40s. Totally not, the family totally wasn't expecting to have this accident. So they were again locked out because the applicant did not have a power of attorney. He didn't have a will. They didn't know anything about his bank accounts, his assets. So they were totally locked out. And then, we have clients that let's say they do have a power of attorney. They say they do have a will. But if those, let's say the IRA or the 401k doesn't have a beneficiary listed, or there's nothing in place for the loved one to have access to those accounts, the family's locked out and they can't do anything. And we see it day after day. Unfortunately, families are really stressed because there was no preparation beforehand. And so I strongly encourage you when you're doing open enrollment to address these topics with your clients. This is the time when they're projecting their healthcare for the next year. This is a wonderful time for you to encourage them to put together a plan of action, because it'll be a gift to them for themselves, because they'll be able to age gracefully at home, but it's also a gift to their loved ones because that way they're not rushing um, uh, frantically trying to find, their accounts, their passwords, all of these things that make it very difficult to take care of a loved one. And then, let's say the loved one is in a nursing home, so that nursing home is pressuring them to, pay $16,000 a month to take care of them, and so there was no preparation, and so the family feels that they'll be medically bankrupt. So Medicaid planning goes such a long way. And when you guys refer people or clients to us, we waive our consultation fee for them. So we're happy to sit down with them and to put together a plan of action and to really help the wheels to turn for them to start planning ahead. Because as we can see, things, traumatic or tragedies happen, they can happen at any moment. But being prepared and planning ahead can really help you help your clients be able to protect themselves and to put together a plan of action. Now let's look at the Medicare Savings Program. So we talked about the Maggie, the group that's under 64 that have low income. They're typically not are disabled. They're children pregnant women in that category. Now, and we talked about how they have to apply the New York State of Health will say, for instance, the state healthcare exchange. And then we talked about the non-Maggie. They're over 65. They're on Medicare. They're disabled. These are the ones that need more Medicaid services. They need additional Medicaid services. They need home care or nursing home care, things like that. And they apply through their local Medicaid offices. So we talked about that, but let's talk about Medicare savings programs, because you as brokers, this is a part of your world every day. And so you're meeting someone with a varying level of QMB, SLMB, or QI. And that gets all confusing. And I can remember a time when I was introduced to this, and it was so hard to nail down what went with which. But today we're going to talk about these Medicare savings program, particularly those that have Medicaid and Medicare, Medi. They're dual eligible. So the first one we're going to talk about is QMB, or Qualified Medicare Beneficiary Program. So basically, it helps pay their Part A and Part B premium. It pays their deductibles, and their co-insurance is up to 100% of the poverty level. And I encourage you guys to Google which state you live in and look at the chart for 2025, and you'll see the poverty levels listed. Because depending on where they fall within that poverty level will determine whether or not they get QMB, whether or not they get SLMB or QI. Now, QMB does not automatically provide full Medicaid coverage. However, there are some individuals that are eligible for both QMB and full Medicaid, depending on their income and assets. So it's important, again, to find that chart, the 2025 Medicaid chart, and it lists those poverty levels, and you can determine by their income where they fall in the poverty line, and that'll give you an indication of which program they're qualified for. Now, SLMB, Specified Low Income Medicare Beneficiary, this plan will cover their Part B premium if their income is, again, within that 120% percentile of the federal poverty level. In qualifying individual, or QI, again, they don't receive full Medicaid, but they will help pay their Part B premium if they're within 135% of the federal poverty level. So again, by you guys looking as brokers, you print that form, you look at that form, get to know that form, get to know the different levels of income, how far they're over the poverty level. Used to, they would list the monthly income, and it would tell you QMB or SLMB, QI. I haven't seen that lately. I don't know if you guys have. Has anyone seen that lately being published? I haven't seen it, but years ago they used to do that, and it made it easier for us to determine when we were with our clients who qualified for what. But however, everything's clear as mud these days. I don't even think the administration knows what's going on. So it's really hard for them to tell us so that we will know. But you as Medicaid, as Medicare brokers, you're trying to protect your book of business. And one way you can do that is by becoming well-versed with Medicaid and those services, because when you're doing your open enrollment review, you may see that they may be within that income level when they can qualify for various programs. And I promise you, when you help them discover a way to put money in their pocket, they will never leave you. I was recently looking at a TV early morning one day, and I saw the commercials because they're starting for open enrollment, and it was a Humana commercial, and it was promising all types of things. And I was thinking about how many agents or brokers during this time are going to lose a ton of their business because, unbeknownst to them, the client's just going to call that phone number, and next thing you know, they're enrolled in a plan that they don't understand, and it probably doesn't fit their needs. But by you becoming skilled at knowing the different ways to help your clients access products or services that they didn't know they qualify for, they're going to think twice about calling or enrolling in something. They're going to call you and say, oh, hey, Marie, I saw this on TV. Do you think I should enroll in this? And that's going to help you protect your retention. But again, it's helping them see how they can trust you and you'll continue to provide extra services for them, which I think is very important, especially in this time. Now, let's look at another set of services provided by Medicaid. They have the Child Health Plus coverage. It provides comprehensive health care for children under 19 based on family income. And New York is very generous with their Medicaid income limits. And I recently had a client that most states don't have what we have. We have in New York what's called an essential plan. So basically, most states offer Medicaid, but in New York, they actually give you three opportunities for the state to continue to contribute towards your health care. So over that limit, we have they're called essential plans. And I believe the income limit for the highest tier is $62,000. So many people are paying for healthcare out of pocket at their job or through another source. They don't realize that if they make less than $62,000, the average person in New York can qualify for free coverage. The essential plan, they do have small copays. I think to go to a provider, it's $15. To go to a specialist, it's $25. To go to an ER, it's $75. But that's just out of pocket cost. And I think their max is $2,000 total. So what's $75 go to the ER when you could be paying thousands in copays without it? Or let's say they need to go to urgent care. I think for most of them, they're $25. Most people, especially during cold and flu season, do not go to the doctor because they can't afford to. But by us helping our clients, looking at what they have and suggesting them to, hey, why don't you go create an account on the New York State of Health website? Go and see, if they make less than $62,000, go and see what you may qualify for. You may be able to help them put money in their pocket and be able to put food on the table, because let's face it, food costs are expensive. We're about to go into winter, so we have heating bills, heating expenses, oil, all of that. So by us being proactive and asking questions regarding how much they earn, we could help them see if they can qualify for QMB or QI. $185 goes a long way. It may not be a lot to some of us, but to an elderly person on a fixed income, by enrolling in QI or QMB and by receiving that Medicare Part B premium back, it can make a big difference. And by seeing if they can qualify for an essential plan, all they have to do is create a login, like I said, on New York State of Health. And as long as their income doesn't exceed over $62,000, they won't have a premium, but they can still have excellent care through Fidelis or MVP. So even though it may be a little work on our end, it can go a very long way for them. And again, they will trust you and they will think twice about leaving you for another agent or service. Now, the next the next service is Family Planning Benefit Program. It offers reproductive health services to individuals unable to afford them. Then they list the consumer directed caregiving. That is the CDPAP. That's what you guys hear about when family and friends get paid to take care of their loved ones. That's that program. So it allows Medicaid recipients to hire personal caregivers, including family members, and have more control over their care. In New York, I don't know if you guys have noticed, I don't know if you do much. Has anyone heard of the Medicare Advantage Plus plan? It's a different type of long-term care service. Has anyone heard of that or know of anyone that's using that? They typically use it instead of choosing an MLTC. So basically, thank you, Akila. So basically, when a person qualifies for long-term care and they have everything set with the application, they're approved and they've been determined disabled in the state of New York, then they have to choose whether they're going to go the managed long-term care route, which is typically like with Village Care Max or with Elder Care or Hamaspic Choice. Those are large elder law MLTC plans in this area. But New York has introduced what's called an MAP. It's a Medicare Advantage Plus plan, where basically they're streamlining all of their long-term care services. And the only reason I'm bringing this up is because I want you as brokers to be aware of this, because what I'm noticing is when they sign up for this MAP, they're automatically enrolled into a DSNP. And I've had some conversations with Akeem before. I'm not really sure if they are giving the broker credit for it, or they're even compensating them for it. But when they streamline it, and some of them are able to use the CDPAP, the home care services, hire their family and friends. But what makes me a little leery about it, it is cutting the agent out, the broker out totally. Basically, they're streamlining it, making it very easy for them to get that food card or get that OTC card, but the agent, the broker is cut out. So when you're working with your clients and they're on, if they're on a Medicaid Advantage plan or things like that, just be, or let's say you get a referral from an agent or someone and they qualify for Medicaid services, long-term care Medicaid services in the home. I would inquire, make sure that you do your research about the MAP, because from what I've been noticing, some of them, if not all of them, are cutting the agent out because it's just easier for them to enroll that client in that program, and they're making it as if it's so easy for the applicant doesn't have to worry about it. It's easy, but again, we're talking about protecting our book of business, and so with the MLTC, when I have a client, we have clients that qualify for Medicaid, for full Medicaid. I will send the client back to an agent, because I still have my life and health license. So I send it back to an agent in my group, or if you send me a client, I send them right back to you so that you can get them into a DSNP or get them into a plan that fits them. But just be very careful when they have these new plans, especially in New York, because they're really sneaky. And I do a lot of research. So if you have any questions or something seems strange or weird, please send me a text or email, and I'll definitely do some research for you, because I want to be your resource. I want to help you protect your book of business, and I want to help you learn how you can protect your client, your book of business, and provide them more services. And the last service that is provided under Medicaid is called EPIC. It's a senior pharmaceutical support. I'm sure you've heard of that when you're meeting with your clients. But basically, it helps seniors supplement their Part D drug costs to reduce out-of-pocket expenses. So usually it's like a monthly fee. I think I've seen it like maybe $12 a month or something like that, and they receive it because sometimes their income, they're over that poverty level, and they don't hit it right on, and Epic can come in and help. Again, the idea is just to, it's to save them money and to help them try to get as many services as they qualify for. So guys, that's really it. We talked about a lot, and I did record this, so if you would like a link to the recording, if you came in late, I'll definitely send it to you. But basically, our goal is to do everything we can to stay a step ahead for our clients. We're in a climate now where we have to fight to protect our clients, because we are faced with, just as you're reaching out, just as you're doing presentations in pharmacies and different things, other people are doing that too. And it's very important that we try to provide as many services as we can so that we can help them. Number one, have access to services they didn't know about or that they desperately need. But also, many times these products put money back in their pocket, which, if any of you work with those that are on a very limited income, it could mean paying the light bill or eating a healthy meal. So by us being ahead and being well versed, I'm not saying that you have to know everything about everything, but having the right connections, networking, asking the right questions, it can help us provide them with great services so that, like we said, every open enrollment, they're going to call us and say, hey, or don't forget about me, or when they have questions or their family members have questions, they'll reach out to you and they'll refer them to you. So now I'm going to open it up for question and answer. Unfortunately, guys, my camera is not working. I don't know why. And I forgot to ask my husband to look at it. So I'm here, but does anyone have any questions that if I know the answer, I'll tell you. And if not, I'll do some research and look it up for you.
Tamika, I do have a question. This is Aquila. Sorry, my reactions are not working well.
No, it's
I
okay.
have a question. I wanted to know, sorry, my husband just got home. My question was, I had a client who I actually just referred to you, and she told me that her mom had irrevocable trust, and she said she did not like her elder attorney. I gave her your number.
Hmm.
She said that they have a 5 year look back, and I thought for some reason I heard that now it's only 2.5 years, but also I thought that in New York they don't look back, but it was maybe it's because she wanted to put her into an institution.
Yes. So that is the difference. We do not have a look back period for home care, but
Mhm.
unfortunately for nursing home, we do. And there's nothing we can do about that. It's a 5 year look back. So you're right though. We don't have one for home care, but um it's and again we talked about it a little bit earlier. It's clear it's mud, unfortunately. But when you're dealing with nursing home care, there's a 5 year look back in every state. It doesn't matter where you live.
Thank you. Can I have one more question,
Yes, ma'am.
Tamika? What is the difference between QMB and QMB plus? That's what yeah.
That's interesting. Has anyone heard of QMB Plus?
No, what does that stand for?
Marie. Okay, Marie, go ahead.
So people who are on full Medicaid are either over 65 at least or disabled. The Medicare people on full Medicaid are either FBDE or QMB plus. And that's so that found out the well, I don't know which application exactly, but it's the full Medicaid. If it's only the Medicare savings programs, it's what you said, QMB, SLMB, QI.
So you're saying it's someone with full Medicaid and
Yes.
basically, okay. That's interesting. I haven't heard of that. But that's interesting. So basically it's someone that has full Medicaid and so basically I just looked it up. So basically it is a type of Medicare savings program that provides full Medicaid benefits in addition to Medicare cost sharing. Yeah. So again, because we did talk about that a little earlier, and but yeah, Aquila, I'll send that to you. I'll send you these. I'll email it to you, the
Thank
notes and everything. You're welcome. But again, there's so many things. There's so many new products, and with the new beautiful bill that they put forth through by the administration, it's going to continue to be hard to navigate this because they don't want us to figure it out. They don't want us to know they don't want us to know anything because unfortunately they want people to be in confusion. And it's really sad but by us, like we're just doing, networking, asking questions, by putting it out there in this forum, we'll be able to help one another and be able to um, help our clients most importantly, because it's becoming so difficult. Everything is so fluid and it changes by the day. So but no, thank you, Marie. That's wonderful. I'm going to drop in the chat. I did find the chart for the poverty level. I'm going to send this to you. So guys, I put in the chat for you. What did I put this morning? Okay, so when you're doing open enrollment, because I know you guys are about to start meeting with your clients, I put the state specific Medicaid eligibility requirements in the chat for you. And I also put the cheat sheet for whether or not they want to need a pool trust or a irrevocable trust. That'll help you with that, to navigate through that. And then I just also put in that link for the determine where they fall in the poverty level, because even though we don't talk about co-pays and things with QMB and all of those, the income is the most important for all of this because it's an income driven program. So numbers always matter. And even though, sometimes I see I'm old school when it comes to the healthcare industry because I grew up in the industry. So I over research and I probably over look into things, but I feel like it's important because we know with healthcare, one small thing can make a difference. And by us empowering ourselves and empowering one another to learn as much as we can, it's going to give you guys more resources so that you can help your clients and you'll be able to help their family members and to help their loved ones. And so during open enrollment, as you're going with your client, you're meeting with your clients, listen for those words, home care. Listen for having can't cook, can't having a hard time with daily activities. Listen for trigger words, dementia, Alzheimer's, congestive heart failure. Even mental illnesses now are Medicaid eligible. Listen for those because that's going to help you be able to help your clients when they find services that they didn't know that they qualify for. So imagine how good and great you'll look when you mention, oh, by the way, you said this, you said dementia, Alzheimer's, that you can qualify for home care services in the state of New York. So anyone disabled can qualify for long-term care Medicaid. Anyone that's disabled. So just remember that. We just have to put the pieces together. That's where my paralegal training comes in, along with my healthcare. We will put the case together when we present it to the state so that they get qualified. And again, I waive the fee. When you send us referrals, we waive our consultation fee. So you can send us. I do ask that you try to pre-qualify them. I do ask, like, if you could get that cheat sheet that I gave you and kind of look through it and kind of get their income, have some data for me when you come, get their income, get their assets as much as, I know sometimes people don't want to talk about it, but even I lost my thought there. Sorry. But anyway, basically, even a ballpark number, they could say I roughly have 80,000. People don't like to tell what they have, and that's fine. But they could say I roughly have 80,000 in the bank, and I have roughly, I have a home, and whatever, and we can Google and look up their the market value and things like that. But try to pre-qualify them when you're talking to them, because this is the perfect time to get their information. They're preparing for next year. So get their income, get their assets, and find out exactly what type of home care services they need. New York has increased the activities of daily living to qualify for Medicaid. So I've always tried to submit at least 3 out of the 5, but now they're definitely requiring it. But again, we can put it together. We can have dementia, or we can have congestive heart failure with their fall risk. They're non-ambulatory, or they have arthritis, or crippling arthritis, or they have different illnesses, hypertension, diabetes. We can put that all together to show the state that collectively these make it very difficult for them to do their day-to-day living. And I will work with you and I'll work with them so that we can put the pieces together, because more people qualify for home care Medicaid than they realize. And unfortunately, the state is not going to tell them. So, and if you have a client that you're meeting with and they have a spend down, call me. I can make a referral. I don't make any money off of it, but I can make a referral to the pool trust, and we can say for many people, 95% of people, all they need is a pool trust, and the state will never tell them. And we use a company now that loads their spend down on a debit card, and it makes it easy for them to pay their bills, buy food with that debit card. They can pay their property taxes, car insurance, all of that. And their family can have up to 60 days if they pass to get that money out of there. So we have a lot of resources, guys. And so when you're out, meeting with your clients in open enrollment, please send me a text, send me an email, and let me know if you have any questions, because we're here to support you guys and to help you during this time. All right, guys, that is it.